We love this town.
It's a good place.
We love it here.
There's like a peace of mind.
That's funny.
It's nice.
It just feels safe and secure.
You've seen this public service announcement on our air, but have you really been listening? This message is so important. Denial, Ohio is real. And for the next half hour, we are paying it a visit, asking the real question: are you moving in or are you moving out?
Opioids?
It doesn't happen here.
No.
No, it's not in denial.
No.
No.
There's no way.
Yeah, they're prescription pills.
They would never abuse opioids.
My boys would tell me anything.
Exactly.
No, our kids are way too busy.
My daughter is good friends.
He gets amazing grades.
Welcome to denial.
We're doing okay here. That's what living in denial, Ohio means to me.
Kids as young as middle school, high school. This is not just a problem that affects adults.
Ohio has a huge problem, and I was a part of that issue.
I think there's a lot still that needs to be done.
That people are afraid of prevention and afraid of treatment just because it's uncomfortable to talk about with a child.
My name is David Siegel, and I'm a person in long-term recovery. And my message is simple: we do recover. You don't have to crawl on your hands and knees through life.
As these parents rummage through a make-believe teen's bedroom, they're finding disturbing stuff. A beer can concealed by a fake soda sleeve.
Usually just put like a skin over it.
What appears to be a can of WD-40 has a false bottom. Drugs can easily be hidden here from mom and dad. Upper Arlington High School put together this demonstration so parents would know what to look for if they feel the need to search their kid's room. Police say never be afraid to do that.
Parents, as the kids get older, they want to give them their space. They say, well, you know, I want to give them a little more privacy. I want to, you know, they're growing up. They haven't given me any reason to doubt them. So they just kind of tune out. And you can't do that. You can't do that at all nowadays.
It's like living in denial. Kelly Sweeney on the left and Debbie Culp have children in the Upper Arlington district. They're on a mission to stay on top of every aspect of their kids' lives, including regular talks about the dangers of drugs.
And those conversations are uncomfortable and they're awkward, especially when you have a 12-year-old son who's like, Mom, actually we're having a conversation last week, and I said to my son, I'm like, buddy, listen, I don't want to have this conversation with you either. It's just as uncomfortable for me as it is for you.
So here we are in 2019, and it's a problem that continues to be with us, and in some ways it's growing. David, talk to me about your journey. When did you get hooked on prescription drugs, and how did that happen?
Sure. You know, I started when I was 12 years old, just dabbling and being curious with friends, boredom. I think rebellion has a lot to do with it too, and plus I wanted to fit in. And as I was going through high school and middle school and high school, it took a turn because, you know, one thing led to another, and the pills or the weed wasn't there anymore, so, you know, we would try different stuff. But it turned out when I was playing volleyball, I hurt my back, and that's when I got prescribed 8 different medications at one time. And that's when I would say that it took a turn for the worst, because now it was quote unquote legal for me to have them, and I, you know, was abusing them as well.
So the injury had gone away, but an addiction was grown through that.
That's right, absolutely.
Is that the story you see at Children's Hospital?
You know, for a lot of the patients that I see, a common trajectory, such as David's, is something that is a story I hear over and over again. A lot of people will maybe start using things like marijuana, alcohol, cigarettes around the ages of 11, 12, 13, and then start to experiment with other things, whether they get them from household cabinets, friends, family members, whether they go to a party and somebody else brings pills and stuff like that. They start to use and dabble in those types of medications, prescription pain pills, and then depending on if an addiction does develop, the need for getting those pain pills becomes more and more. They start to use more, and then eventually it's harder to get those pills, and people run out of money and find out that heroin is actually a lot cheaper than a prescription pain pill, so often then move down the road to using heroin and then progress to IV drug use eventually, if that's the way that they need to continue their addiction.
David, you're dealing with middle schoolers and high schoolers. How aware are they? How hip are they to what's going on out here? Do they know what's happening, and do they know the risks of taking these drugs?
Yes, they're very smart, and you're seeing younger and younger kids starting to know everything. I mean, music videos will show drugs and alcohol use every 14 minutes. So a lot of the celebrities that they're looking up to and stuff like that, rappers, musicians, they know. And you know, I ask them questions too, these middle schoolers and high schoolers, and they know everything.
Are their parents surprised that they know what they know?
Absolutely. They're so surprised. They had no idea that they would be so educated inside their own school.
So, doctor, from your perspective, what can be done? What's working? What's not working as far as getting people off these drugs or getting them away from them?
First, I think awareness is extremely important for parents to be aware. Prevention efforts. I recently attended a community conversation panel in New Albany where the police were there, I was there, fire was there, comp drug was there, and it was for the parents to educate the parents. And it was enlightening for quite a few of the parents. So I think we obviously need more treatment facilities. I think we need better numbers, better statistics in terms of we don't quite know how many people are addicted. You know what I do, so what I see are the people who die, right? And most of them have been in some sort of treatment, and their recovery has not been sustained.
When parents bring their kids to you, what is the mental state of that parent?
Shock, disbelief, scared. I think just underlying scared, frightened for their child's life. You know, I think there's still always just an underlying sense of, where did I go wrong? How did I miss this? How did I not see that this was happening? You know, and really just helping, we try to help families, parents as well as their children, realize that this isn't anyone's fault. No one asks for this to happen. No one asks to be addicted to any substance. And so really trying to take away just that moral sense of, what did I do wrong? How am I here? And really talking about it as a disease, and how do we now treat this disease that your child has? And going forward in that manner so that they start to recognize it's not a moral failing on anyone's part, but it is a neurologic disease that we can work forward to treating and managing for the long term.
How does a parent not know their child's got an addiction?
I think it comes down to communication. The fact of it is my parents were great parents to me. It was the people I was hanging out with 90% of my time, not knowing, you know, asking the questions I needed to, and seeing, you know, is this friend a good friend of mine? Or seeing, you know, me being depressed coming home from being bullied or something like that. Again, every parent wants to be able to help their child any way, shape, or form. But a lot of times it comes down to guilt. You don't want to put that onto the parent. They've never been 16 years old. You know, that's just the mentality a lot of these younger kids are thinking. My parents never had social media and stuff like that. That's another huge thing too. These kids are stressed. So upon that, they're going to find a release, and they're not going to tell their folks about that. And I think what we need to do is start having the conversation be more non-judgmental, in a loving, caring way, and saying that, you know, we're not going to enable your addiction, but we will enable your recovery every step of the way.
I agree with what, you know, David was saying, and really research shows that just having conversations with your kids and keeping an open dialogue about substance use and about drugs decreases their risk of using drugs by 50%. You know, just keeping an open conversation about that, and knowing that drug education does happen in schools, but don't leave it just to the school in order to do that. Make sure that you're talking about things at home and keeping an open, supportive dialogue about about substances and about, scenarios that might happen at school, and bringing up, those types of things, or what would happen if someone were to offer you things at school, or, bringing up someone's positive traits and all of those kinds of things to make sure that they feel supported at home and that they feel and it's a supportive environment to bring up concerns and to bring up that kind of stuff. And not just have it be a fear of, if my parents find out, having it be more of an open conversation. And that seems to definitely help protect kids more.
When a parent says to a child who's addicted, well, just stop, what are they missing in that statement? What don't they understand about their addiction?
We know addiction is a medical disease, and it's just like telling their wife or their husband, stop having high blood pressure or stop having diabetes. You can't just stop.
A lot of times this drug addiction catches a parent unawares. They have no idea that their child is doing this, but sometimes it's hidden in plain sight. We've got a bedroom here that could look like a typical kid's bedroom. Where should parents be looking in this room if they think there's something up with their kid?
Any crevice, corner that you can think of. I would look under mattresses, you gotta look under rugs, you gotta look in the areas that can twist off and put little things in where the holes are at in bedposts. So check every corner, crevice, underneath things, in between corners, you name it, look for it. Even in vents too.
Yeah, my investigators have seen it in the outlets. Behind the outlets, you unscrew the outlet and it's back there.
And found a stash there, huh? As we wrap up here, any final thoughts? What's top of mind for you as you go back out into your profession every day and deal with this? What's on your mind these days?
For me, it's specifically, I just want people to know that we do recover and that there is hope, and that Ohio is on the forefront of trying to really clean this up and to fix everything that's going on. And adding more aftercare programs and rehabs are vital to to our recovery. But to have people know and tell people, hey, we do recover. We can get over this. You don't have to be crawling on your hands and knees through life because you're addicted to drugs, and it's nothing to be shameful about. I've been there. I've walked in those shoes, and for me, I want people to know that, and for families to know too that there's hope. Moms and dads out there, you're not alone.
And from a treatment standpoint, definitely, seconding his statement of there is hope. There is hope. People do recover. People do recover, and they go on to lead productive, successful lives. So that does happen. We hear a lot of times about the overdoses and about the increase and all of the negative things that are happening, but there are many people who do go on to recover. I think also when thinking about things from a prevention standpoint, it's important to know that we can't wipe out using opioids. There are people who do need those medications for pain control. I think it's important, though, if you have a child who's getting these medications prescribed, talking to the prescriber about, is there another form of pain medicine we can use? If not, what's the shortest amount of time that we can be on this, and how do we transition off of it into other medications like ibuprofen or Tylenol? If those medicines are needed, making sure that they are secured in a locked box in the house, not left in a household cabinet where anyone can go in and get it. Making sure they're being monitored so that the parent is counting how many pills are in there so that they'll able to see, is anything missing? Knowing how to transition off of that medication to something like ibuprofen or Tylenol for pain control so they're not having to stay on that opioid for a long time, as well as knowing where to take that medicine to dispose of it, to get it out of the house, to get it out of anybody who might want to take it for recreational use.
One of the things that I find when looking at records of the people who die of overdoses is many of them did start as early as 16, 15, 14, 13, 12. And so therefore it's just so important that family unit, whatever it is, whether it be a single parent, two parents, a grandparent and a mother, grandparent and a father, family unit needs to communicate. And then lastly, recovery is just so important. And getting that information out there that there are sober living facilities out here that you can look for. There are peer supporters out here that will go with you hand in hand in your journey into recovery, and that's their That's what they're there for, is to help you through your recovery and to make it more successful. So there are some supports out there for you if you do have an addiction.
Oh, great. Thank you all for being with us today.
Of course,
Thank you.
Thank you.
What does living in denial, Ohio mean to me?
We have parents and employers and folks all over the country living in that state of denial.
I wasn't probably as informed as I should have been.
We know how to help people, but we have too much stigma still.
The problem of substance abuse knows no boundaries. It's everywhere, including the business world.
Employers need to be very careful that they're not living in denial about their own employee base, because these things are happening, and while it may be very, very rare that someone's actually impaired in the workplace, drug use, alcohol use, the abuse and misuse of those are taking a toll on the workplace.
Nationwide Insurance developed a program back in the 90s to help employees dealing with substance abuse problems. The company says addiction should be looked upon as a disease, not a character flaw.
Anyone becomes overwhelmed with stress, financial stress, personal stress, and they can cope in unhealthy ways. So it can happen to anybody. We just want to make sure we're there with our resources to help them.
Access to intensive outpatient drug treatment is part of the medical benefits package for Nationwide employees. In some cases, workers can stay on the job while getting the treatment that takes place outside of working hours.
We hope that when they start to recognize those triggers again and things kind of going back down to that destructive path, that they'll use the resources that we initially set them up with. That's what we hope.
Random drug testing and 2 years of aftercare are also part of the package. Nationwide says about 60% of those who complete the program stay clean into the second year.
Taking that person when they're really in need of help and holding their hand all the way through until they can be successful.
We've been talking about drugs in the home, particularly teenagers, adolescents, and families finding out about that. But the workplace is also a problem, and tell me how you've been addressing the issue of opioids, alcohol abuse in the workplace.
Well, we've really been focusing on education and awareness and intervention, and education of our leaders to recognize when someone may be in crisis or impaired. It doesn't happen very frequently. People don't generally use in the workplace till everything else has kind of fallen apart. It's one of those last places. But it is one of those that if we can intervene, then we can change the trajectory of this person's life, right? They won't go on and potentially lose their position. We can get them into rehab. We know, while it doesn't happen very often, when it does happen, we have great success measures. We have great success outcomes. We have a team of people who intervene, get you into assessment, get you into help, and then follow you. We actually follow people for 2 years after the end of their rehab, and we know it works and people are successful. So employers really do need to not live in denial either and be aware of what do those signs and symptoms of someone using on the work, at the job or in the workplace look like.
There's a lot of information out. A lot of people are talking about this problem, but it's still there's a stigma attached to it. Some people are just embarrassed, or they have fear, particularly talking to their employers about that. How do you knock that down and get them into the help that they need?
I think the key for us is the frontline supervisor and the brothers and sisters keepers approach that we use in our culture at AAP. We try to educate folks around drug, alcohol abuse, and we really encourage one another to look out for the brothers and sisters. In our business, any job can be a very critical job. Working with electricity, they don't have the ability to make a lot of mistakes without being serious consequences. And so, similar to Nationwide, it's about education and outreach and providing people a confidential mechanism to get help.
Is there any training for managers of people to look for warning signs about something's not quite right here and maybe we need to investigate this a little bit?
It's now recognizing associates in crisis or impaired, because oftentimes what you'll find is that there may be some crisis that kind of pushes that person over the edge. And where I was able to kind of keep things together, I've got a new crisis in my life, and now I'm using and I'm bringing that to work.
How do you work through that with the employees who have a problem? Do you allow them to stay on the job, or do you make them come off?
So initially you have to come off and you have to go through an assessment. We work with Optum Health. We do have 8 sessions, but we do the assessment first. And so the person actually goes to the assessment. We have a case manager at Nationwide who works individually. She's the person who talks to you about going for testing and then sets you up with that assessment. From that assessment, they make a determination about whether or not you can come back into the workplace and go through outpatient. You may be, right now we're seeing a lot of people who are intensive outpatient, and those outcomes are really good because you're not leaving everything in your life to go inpatient somewhere and then coming back to the same life, right? So it really depends on what you're using and what the recommendation of the professional is in terms of whether or not you need to be inpatient or outpatient. Obviously, if you're outpatient, it's much easier to be able to work.
What are the drugs or substances you're seeing abused that gets a person into treatment?
Well, a person will get into treatment if they're abusing prescription opioids, marijuana, cocaine, any of the illegal substances. If they come in positive for any of those, we have a 2 kind of bite at the apple approach too. But given our work, we would probably remove them from dangerous work until they do get a clean bill of health. That's, of course, there's a difference between sedentary work and our physical workforce. But again, we would probably rely on the medical providers. But as a rule, dangerous work, they have to be drug-free. And so that's, part of our business because it is so critical that they be clean.
You both represent large corporations with hundreds of employees. But what would you say to the little guy, the smaller business person who may have somebody on staff that needs help too? What's your advice to them?
So first, I would say there's a lot of great resources out there available. One of the things, the National Safety Council has a calculator where you can put in the line of business that you're in and the area that you work in, and it will give you estimates of how many people are using alcohol or marijuana or drugs to give you a sense of what you should be seeing in your workplace. And then I would say work with the resources that we have. We have great resources here within the Adam H, the programs that we have. And don't turn a blind eye to it. It's not going to get better.
What would be your advice?
For small employers, I would say culture is everything. You have to know your people. You have to admit that there is a problem. Take care of the people that work for you. If you see things that aren't right, if they're having stress at home, they're going to compensate for that. And so just being there and caring about them, letting them know that there are resources available, reach out. The public sector and the private sector have all kinds of resources that people can get. And I would say, know your people and just take care of them.
Great. Thank you both for coming in today.
Thank you.
Appreciate it.
He just seemed about a half a beat behind. He just didn't seem like himself. A lot of our focus needs to be on preventing future addictions. I needed to find a way to keep other people from going through what our family went through.
So here we are in a full-blown opiate epidemic in this country.
Yes.
And yet there are people who don't want to talk about it. They don't want to think about it. Why the reluctance still?
Because people think that it's a choice that someone made. They made a really bad choice. It's those people. They've attached a stigma to both alcoholism and drug addiction. And they both, addiction is a disease. When my son had addiction, people just looked down on him. And it's something that he was very ashamed of at that point in time, because he died in 2015. So that was kind of toward the beginning of all this. And he was made to feel that he was a lesser person because of it.
What was your reaction when Sean told you that he was addicted?
Oh, he never told me. I noticed that he was maybe half a step behind, half a beat behind. I knew something wasn't quite right, but I couldn't put my finger on what it was. Part of the disease is that they become very good at lying and manipulating, and they cover their tracks. They always have an excuse. And so he always had a reason, but it kept getting a little bit worse.
Was it an injury, or how did he end up getting hooked?
He hurt himself during finals week, his junior year of college, doing a dumb thing that he wasn't supposed to do, that his mom told him not to do, that he'd get hurt. So he didn't want me to know. So he didn't go to the ER, didn't go to the emergency room, didn't go to urgent care. He was living off campus, and a person in the house next to him handed him about, I would say 4 pills, I think is what he told me, and said, "Here, take these, you'll be fine." And apparently he was, and he liked them, and he went back for more. And that was the start of a very ugly 5-year odyssey.
So he was in and out of treatment and addiction for 5 years?
Yes.
And what was the episode that took him?
At least he said he had been working on getting clean. He was living with his girlfriend. They had kind of a toxic relationship, and he'd asked me if he could move back in with me, and I had agreed. He moved half his things in. I'm going to go back, I'm going to spend one last night with her. And then the police knocked on my door at 4 in the morning to let me know that he had died of a drug overdose.
Up until then, he had been clean?
Well,
you don't know.
I don't know.
Yeah.
He'd said he was working hard on being clean.
Mm. When you talk to other parents about it, what's their reaction to you? Are they resistant, or are they accepting, or is it a revelation for them?
I had been very open about Sean's disease of addiction while he was going through it. But I remember when it first happened, I was a little reluctant when he first became addicted, because people, there's a stigma, and people kind of look down, and I just told Sean, if you don't talk about something, it can never get better. You have to talk about it. You have to bring it out in the open.
Did you ever feel at some point you failed?
Oh yeah.
Did you?
You look and say, what did I do wrong? Mm-hmm. How did I let this happen? How did I not know it was happening? How could I, as a mother, you always want to make things better. You always want to fix things.
What do you think is the biggest danger of people living in denial?
Oh boy, that's a loaded one. The fact that they aren't aware of what's right under their nose. I mean, when someone is suffering from addiction, we all suffer. I mean, it affects the whole community. So we all have to look out for each other. We all have to try to help each other. It affects the community not only in the fact that we're losing people, dying of the disease of addiction, but it's going to cost us a lot of money. Financially, it's hurting us, and I think we all have to pull together and to try to find a way to stop this process.
We making some progress, you think?
We're making people aware. I think education is key. We need a lot more education. So I think it is getting better. So far, there is no cure for addiction. And I don't know. I haven't found a way to successfully treat addiction that helps everyone. It seems to be an individual thing. So I think one of our best bets is to try to create fewer future addicts.
Dr. Parsons, thank you so much
You're welcome.
for talking to us today.
You're welcome.
I guess it's such an emotional, psychological shock to them that their child may have an addiction.
When you realize that it's one of your own, it hits home, and I think people tend to listen better.
Sit down with the individual, get a professional on hand that has been through it, like myself, and sit down in a loving environment, non-judgmental whatsoever. They don't want to feel attacked, because if they feel attacked, they're going to check out, and they're not going to listen to you.
I think we still have towns called Denial, Ohio here, and I think we need to address that a little bit more.